The Prescription Drug Misuse Education and Research Center at the University of Houston College of Pharmacy is a college-level research center that is focused on improving patient outcomes related to everything that has to do with prescription drug misuse.
We address a number of different types of addictions: opiate use disorder, prescription drug misuse, and all of the things that are sort of related to it, including mental health issues, access to care, equity in care. We collaborate with a number of different people, starting all the way from other academic institutions to other government-based entities. We work with a lot of funding agencies, the National Institutes of Health, SAMHSA, all the way down to individual members of the community.
Houston is the fourth biggest city in the country and really lacked targeted and focused research related to prescription drug misuse until the Premier Center was founded in 2018.
We are a very transdisciplinary team, so we have a number of faculty who come from a variety of backgrounds, including pharmacy, medicine, public health, psychology, counseling. So we are a team that's very multidisciplinary. We're a team that's very collaborative in working and addressing the primary issue, addressing addiction.
So when we initiate a patient on treatment, we're going to allow that patient to receive maintenance pharmacotherapy for as long as they need. Pharmacists, who are oftentimes reluctant to dispense medication for opioid use disorder, sort of want to know when that patient is going to be through with treatment as soon as they start. Opioid use disorder is not an acute disease state, it's a chronic disease state. And so communicating that between providers and pharmacists is an important part of making sure that access to treatment is maintained for the duration of that patient's care.
The Premier Center is an excellent place to receive additional training. That training could come during your academic career as a pharmacist, it can come in your undergraduate programming, or it could come as a postdoctoral fellow. We've had tremendous success training all levels of individuals across the spectrum. We train people to be better researchers, to be better clinicians, and to be better patient advocates. We want to make sure that our members are there for their communities, whether those communities are out within the city of Houston, within Harris County, within our own campus here at the University of Houston. Lessons that we learn here can be applied across the state and across the country.
Premier Center is fortunate to collaborate with a lot of different individuals, and I'll focus maybe on the education side. We're able to provide a lot of different educational programming for not only pharmacists, but other healthcare providers, community groups, and lay patients as well.
We consider it vertical integration of our research center to be able to provide all components of a research project under one roof. Vertical integration allows us to go from initial data collections with key stakeholders, including patients or physicians, all the way through developing and evaluating large-scale interventions.
Our Educate Before You Medicate project provided community pharmacists with both an education toolkit and safe disposal options for prescription drugs in order to help these pharmacists provide safe and effective counseling for these medications and disposal options for patients. So not only did we provide the tools and the resources for our frontline colleagues that are in the community pharmacy in order to ensure good outcomes for their patients, but at the same time, it also gave us good data on barriers and different issues that these pharmacists faced in helping take care of these patients, and that would help us inform our future education and research efforts as well.
One of the most common sources for illicit opioid use among children and adolescents is medication that is taken from the medicine cabinet. Every year in the United States, there are about 25,000 to 30,000 visits to emergency departments due to unintentional medication exposure in children. Our group operates a program called TIDES. We provide three types of products currently. We provide a mail-back envelope, which individuals can use to put unused medication in the envelope, then they stick it in the mail, it goes to a facility where it is incinerated. We also provide a couple of deactivation products. One of them is a pouch. You add the medication, add water, and then you can chunk it in the trash. And then we also offered packets, which are little small sugar packet sized things, get dumped into a prescription bottle, water is added, and again, renders that medication beyond retrieval. Since we started in 2018, we've expanded our network to include over 800 community partners across the state. And we estimate that we've taken back somewhere around 10,000 and 12,000 pounds of medication.
Premier Center has done a wonderful job in assessing the outcomes of their interventions and constantly using continuous quality improvement methods to enhance those interventions for the future.
Prescription drug monitoring programs are a critical tool in understanding the way that controlled substances are used at the community level, in that they capture information on all patients, regardless of who is paying for their medication. Having access to all payer data is a vital part of our center's approach to understanding prevalent patterns of controlled substance utilization at the population level. We really want to be able to use this data to shape policy, to help lawmakers understand the potential impact of delayed access to treatment in the community setting, and to be able to not only identify areas of great need, but also to ensure that we are able to provide human capital and to expand the treatment and prevention workforce in a way that can serve this new need that's been created by the influx of fentanyl into the U.S. drug supply chain.
Lives are lost every day. It is a problem that is not going to go away soon, but we must develop strategies like those that are being originated in the Premier Center to help our country deal with these ongoing issues.
We want to make sure that the problems facing Americans today are solved with the help of researchers at Premier.